Bismillah ar-Rahman ar-Rahim. Hello all my friends and my colleagues and my fans and my students everywhere. Tonight I will speak about an important issue, which is toxins and pathogens and drug-induced organ damage. First of all, we have to know that humans are exposed to toxins as well as to pathogens. Pathogens are microorganisms or microbial agents which might affect human beings with all its types or all types of pathogens, including bacteria, viruses, fungal infections, or sometimes we call it mycotic infections, and parasitic infections, with all its categories and subgroups. This is on one hand the pathogens, the microbes, and these are mostly biological agents. That they have agents which have life, and they might attack human beings, and they cause diseases, or they put humans at risk of disease. The pathogens. Then, on the other hand, we have the toxins. Toxins, different from pathogens. Toxins might be chemical toxins, physical toxins, biological toxins, even behavioral toxins. The word is a toxin sometimes. The word which you pronounce intentionally or non-intentionally is a toxin. So be careful of your words, please. This is just by the way. Let me go back to the toxins which are injurious to human health and might be risky to human beings and put the human race at risk of disease. As I mentioned, might be chemical, physical, or biological, or irradiation, like nuclear exposures and atomic exposures, etc. These are all toxins. One of these toxins is drugs. And this is the purpose of my talk. That's drugs. Drugs, they are toxic or potentially toxic, and they are harmful to human health in a way or another. Yes, we use drugs to treat diseases, but we should not forget that the drugs are not 100% safe. They are chemicals, and this chemistry enters the human body, might interfere with the physiological functions, and they might cause alteration in the body physiology, and even they might result in pathological changes. And this is what we call the drug-induced organ or system damage. Drug-induced organ damage, they might mimic any disease, localized or systemic disease. Drug-induced organ damage, they are mostly related to the liver and the kidney, because the liver and the kidney are the organs most commonly responsible for the metabolism and excretion of most of the drugs and the chemicals which enters into the human body. So many of the drug-induced reactions or drug-induced injury or damage is related to the liver or to the kidney or both. Yeah, that's most of the drug-induced organ damage, most of the bulk of drug-induced organ damage, we can find it in the liver and in the kidney. And this is what we call the drug-induced liver disease or drug-induced hepatotoxicity, and the drug-induced renal disease or drug-induced nephrotoxicity. Or sometimes we call it pharmacologic injury to the liver and pharmacologic injury to the kidney. But other organs which are also commonly affected by drugs are the heart, the skin, musculoskeletal system, the hemopoietic system, that is the bone marrow, and this is very important, and maybe also other, less commonly, other systems like the nervous system and the gastrointestinal tract or the gut. All these organs, they might be affected by drugs or the unwise use of drugs or the explicit use of drugs for treatment of disease. That's why drugs should always be taken under medical supervision. We should not take medicine without the supervising or that being supervised by a healthcare provider. And we should understand that for any medicine, the most important point before looking at the efficacy of the medicine is the safety. We should understand the safety of the medicine. The safety of the medicine is the number one consideration before the efficacy of the medicine in disease treatment or disease control, in addition to the tolerance and the convenience of the drug intake, etc. Adverse drug reactions or the drug toxicity might be one of three things. Either it is, this is the classification of what we call the adverse drug reactions. Number one, what we call dose-dependent adverse effects, dose-dependent adverse effects or side effects, and these are usually predictable, and they form most of the bulk of adverse drug reactions, the dose-dependent. And this dose-dependent drug toxicity is related to the dose and to the duration of intake of the medication or the drug. It's dose-related effects, and they form about maybe 80 to 90 or more, 90% or more of the adverse drug reactions, the dose-dependent reactions. Then number two, we have what we call the idiosyncratic reactions. And the idiosyncratic reactions, it might happen from a single dose of the drug. It might happen from one pill or from one capsule or from one tablet or from one injection. So it's not dose dependent. One dose can cause the problem, and this is called the idiosyncratic. And this is sometimes we call it or we consider it as an allergic or hypersensitivity reaction. Allergic or hypersensitivity reaction. And it's usually unpredictable. You cannot predict it. The dose-dependent type is predictable, drug toxicity or drug reaction. But the idiosyncratic is unpredictable. The patient might take the dose without any history of any allergy, and then suddenly he or she develops reaction to this single dose of that medicine for the first time. And this is called the idiosyncratic reaction, and it's one of the most dangerous type of adverse drug reaction, and it is unpredictable, as I mentioned, and it's responsible for about 5 to 10% of adverse drug reactions in clinical practice, the idiosyncratic reactions. And then number three, we have the cytotoxic reactions, which are immune mediated, and they depend on the development of cytotoxic antibodies, the drug-induced cytotoxic antibodies, which damage the tissues and cause inflammatory reaction, which is immune mediated inflammation. This cytotoxic reaction. So adverse drug reactions are either dose dependent, and this is the most common, or idiosyncratic, less common, or the cytotoxic reactions, which is also rare, but it happens in clinical practice. These are the three main categories of adverse drug reactions in clinical, or the mechanisms of adverse drug reactions in clinical practice or in clinical pharmacology: dose-dependent, idiosyncratic, and cytotoxic. What are the factors which increase the toxicity of the drugs? The main factors which determine or which trigger drug toxicity are the what we call the chemical nature, the form and the chemical nature of the drug, the dose of the drug, the duration of the drug, the method of exposure, or how is the drug delivered inside the body, Is it by the oral route, or is it parenteral by the intravenous or intramuscular or transcutaneous? How the drug is delivered, this is called the exposure route, of the drug, also an important determinant. And also, so we have the exposure route, we have the dose, we have the duration, we have the form of the drug and the chemical nature of the drug, and also we have what we call the pharmacogenetics, which is the genetic susceptibility of the individual to develop an action or reaction to a certain drug in that individual. So also the pharmacogenetic constitution of the individual determines whether he or she can develop reaction to that drug. So there are genetic factors and there are acquired factors which determine the possibility and the degree and the type of drug toxicity in a particular individual. And these are important to consider. As regards the, of course, the other factors which might help in the precipitation of drug toxicity and adverse drug reactions are the presence of some pathological conditions which enhance the or which facilitate the toxic effects of the drug in a particular case. And also the possible drug interactions which might increase the bioavailability of some drug, and when it increases the bioavailability of a drug, it might increase its possibility of toxicity or the adverse drug reaction from this medication. So this might arise also as a side effect of drug interaction. That's why when we prescribe medications, especially to elderly people with multiple pathologies, and we are going to prescribe multiple medications, that is 3 or more medicines, we have to think about the possible drug interactions, because drug interactions start to occur in when 3 or more medicines are given to one patient, of course, for different pathologic conditions. And this happens most probably in the elderly population, who are more vulnerable to drug interactions. And one of the important sequelae of drug interactions is that toxicity might arise or might happen. When we combine medications, actually this is one way of minimizing drug toxicity, because we are trying to number one, address the different underlying mechanisms in the pathobiology of the disease. Number two, we minimize the toxicity of the individual drugs used in that combination. So better than to use the full dose of a single drug which might put the patient at a risk of toxicity, we use multiple drugs with lesser doses, or we use 2 or more medications in as the concept of single pill polytherapy, which is a recent trend in the management of many chronic diseases. We put many medications which attack or which address different underlying biologic pathways for the disease in a single pill at lesser doses. So the efficacy will be higher, because it is more pathobiologically dependent, and at the same time the side effects of the individual drugs in that capsule or pill will be less. So this is very important, and maybe this is one of the benefits of single pill polytherapy, given to the patient in many chronic diseases, like in diabetes, in epilepsy, in migraine, in bronchial asthma, etc. So this is the one of the benefits of a drug combination, that is a polytherapy, that is giving more than one medication for treatment of the disease at lesser doses, which is better than giving one medicine at maximum dose for the treatment of this. And this policy of combination therapy, we try always to implement it as early as possible after the diagnosis of the disease. And this is what we call early intensification, or early initial combination therapy in the management of disease, like early initial combination in the management of type 2 diabetes, early initial combination in the management of bronchial asthma, early initial combination therapy in the management of epilepsy, etc. So this is to decrease the drug toxicity. We come back to the drug-induced organ damage. As I mentioned, it can mimic any disease. Drugs which cause liver damage, for example, it can present with a picture of hepatitis. It can present with that is inflammatory liver disease. It can present with a picture of cholestatic liver disease. Also, it can present with a picture of vascular liver disease, especially drugs and the chemicals which might cause veno-occlusive disease of the liver and Budd-Chiari syndrome. Or it can present with fulminant hepatic failure, like some medicines which we use them in non-steroidal anti-inflammatory drugs, for example. The most important categories of drugs which might be injurious to the liver are paracetamol, of course, and this is commonly used medication. It is toxic to the liver, and the main threat of paracetamol is on the liver. And also acetaminophen, a derivative of it. Also antibiotics, they might be injurious to the liver, especially the co-amoxiclav and the macrolides, like erythromycin especially. Also the minocycline or the minosin. Also other drugs like which are involved in liver pathology, non-steroidal anti-inflammatory drugs, especially diclofenac and its derivatives, and also quinidine and the isoniazid and the rifampicin, and some of the oral anticoagulants, and also many of the hormonal pills containing estrogen or containing testosterone. These are also associated with a cholestatic liver disease, and they might cause an inflammatory liver problem. Or problems. So these are different categories, and also many of the psychotropic drugs, they might be threatening to the liver, especially the atypical antipsychotics used in schizophrenia, like risperidone and its derivatives. So these are all groups of drugs, analgesics, non-steroidals, antibiotics, antihypertensives, psychotropic drugs, hormones, and hormone-containing medications, which might be directly injurious to the liver and cause drug-induced liver disease, whether acute liver injury or a chronic liver disease with all its spectrum. It can cause autoimmune liver disease. It can cause granulomatous liver disease. It can cause vascular liver disease. It can cause inflammatory liver disease with hepatitis-like picture. It can cause cholestatic liver disease with intrahepatic cholestasis, as I mentioned, and jaundice. So the drugs and the liver can mimic any liver disease. They can mimic any liver disease. Drug-induced liver disease can mimic any liver pathology. And it can produce the same symptoms and signs. Same also on the kidney. Many drugs are nephrotoxic. We have to be careful of these medications like antibiotics, like aminoglycosides, like diuretics, especially high-ceiling diuretics, Lasix, they are nephrotoxic. Many of the non-steroidals are nephrotoxic, especially the Brufen and its derivatives. Streptomycin is nephrotoxic, gentamicin is nephrotoxic. Diuretics, some of the diuretics, especially the loop diuretics, are nephrotoxic. Many of the anti-cancer drugs also, they are nephrotoxic, and the dipenicillamine, which we use it in rheumatoid arthritis, and the gold, which we use it in rheumatoid arthritis, is also nephrotoxic. So some of the medications which we use them, they might also cause nephrotoxicity with all the spectrum of renal manifestations, from asymptomatic urinary findings up to definite clinical renal syndromes like nephritis or nephrotic syndrome, or even chronic renal damage with chronic renal failure. And some can even cause acute tubular necrosis, like the toxic acute tubular necrosis, like aminoglycosides, which I mentioned them, and diuretics. They cause acute renal failure due to acute tubular necrosis, toxic acute tubular necrosis, because we know that acute tubular necrosis either toxic or ischemic due to hypotension or dehydration, or toxic can be caused by drugs, especially antibiotics, especially aminoglycosides. This group of antibiotics, which we use them commonly in gram-negative bacterial infections, the aminoglycosides, the most common gentamicin and streptomycin, which we use it for tuberculosis, and also the other aminoglycoside medications, nitrilmicin, amikacin, etc. But the most powerful and the most dangerous are the genta and the streptomycin. They are toxic to the kidney, and they might cause acute tubular necrosis. So we have to be careful with antibiotics. We have to be careful with non-steroidal anti-inflammatory drugs, because these are commonly used even over-the-counter medications, which are toxic to the kidney, and some of them, as I mentioned, are toxic to the liver. We should be careful about that. The drugs which are taken orally, they can affect the gastrointestinal tract, and they cause drug-induced gastrointestinal disease. And I mentioned a few days before the pseudomembranous colitis or Clostridium difficile colitis, which is related to the abuse of antibiotics, and they can cause an important form of toxic colitis related to Clostridium difficile and its toxigenic strains, or toxin-producing Clostridium difficile, which cause a specific type of colitis. We call it pseudomembranous colitis, which can also affect the human health and may be directly injurious to health, and carry a high risk of increased morbidity and mortality if not properly treated. And this is related to abuse of antibiotics. The clindamycin, the cephalosporins, the penicillins, the fluoroquinolones, all of these medications, they cause pseudomembranous colitis, which is dangerous, potentially life-threatening gastrointestinal condition affecting the colon, and they carry a high incidence of morbidity and mortality if not recognized and not properly treated. So antibiotics and their effects on the gut is very well known, and the simplest of all is the antibiotic-induced diarrhea. And this is the most simple form of untoward effects of antibiotics on the gastrointestinal tract, just diarrhea. And if severe enough, it can present with pseudomembranous colitis clinical picture with pains, diarrhea, fever, vomiting, hypotension, etc. So the effects on the antibiotics. Also corticosteroids, dangerous drugs. They are potentially dangerous to the human body. They are dangerous to the gut. The corticosteroids can, if not properly used, and if taken on empty stomach, might predispose to peptic ulcer disease, simply gastritis first and then peptic ulcer disease. Same also the aspirin and its derivatives and the association to peptic ulcer disease. That's why these medicines, the aspirin, salicylates, and non-steroidals, should always be taken after meals, not on empty stomach, to avoid peptic ulcer disease due to these medications, which are also commonly used, non-steroidals and salicylates or aspirin. So the effects of these medicines on the upper gastrointestinal tract is well known. Also on the lower gut also can be affected by them. So this is the range of some of the medications which are taken orally, and they might affect the gastrointestinal tract, the upper and lower, and they can also cause even sometimes gastrointestinal bleeding. In relation to the non-steroidals and in relation to the aspirin and salicylates in general. So the drugs dangerous to the gastrointestinal tract, especially when taken orally, and even sometimes if the drug is taken by injection, it can still be excreted in the gut and cause gastrointestinal side effects, even if taken by other routes, not necessarily by the oral route. So whether taken by the oral or by the injection, still side effects on the gastrointestinal tract can occur, the upper and the lower gastrointestinal tract. So we have to be careful about all of these things. This is part of what we call the drug-induced organ damage. For this, I will now finish my on live video for tonight, and I will continue talking about further issues related to the toxic effects of drugs in human beings in further live video presentations. Thank you so much, and hope all of you are peaceful and safe.